Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. For those who have been diagnosed with lung cancer, the care process can be quite confusing. Joining us to talk about this process is board-certified medical oncologist, Dr. Samir Alsawah. Dr. Alsawah, thank you for speaking with us today.
Thank you for having me, Michelle.
Now let's start with the basics. What is lung cancer?
Okay, lung cancer is an abnormal growth of the lining of the airway. Typically happens in a larger airway. If we have the first diagram here, this is the main windpipe that's coming down and then branches out to the right in the lung. This is diagram of the left lung, and that's the main airway, and then branches out to a smaller, then smaller, then smaller. That's the left main stem, then branches out to what we call the bronchi, and then the bronchioles, they're smaller, and then end up with the small and small branches go all the way to the out of the lung. Most lung cancer happens to occur in this particular area, in the bronchioles and the bronchi. But however, it can happen any place. But the vast majority of it happens in a medium-sized airway. Large to medium-sized airway. But once in a while, it occurs all the way out to the far end of the lungs.
Now, how common is lung cancer in our area, in St. Clair County?
Lung cancer in particular is one of the most common in both men and women. It's estimated that it's the second or third most common, depending on where you are in a country. But it's the number one killer, even though it's not the most common. Like only 14% of all cancers are lung cancer, but 28 to 30% of death from cancer are attributed to lung cancer. So it is common. In our area, we are seeing more increase of cancer in general, just like the entire country is. But we have a little bit more of lung cancer in men that we see almost as equal as prostate cancer, which is typically the number one cancer.
What are the symptoms of lung cancer?
And that's one of the problems with lung cancer. It doesn't give us early warning signs. So when the cancer is at the earliest stages, most of the time there are no symptoms. Or there are symptoms that's not severe enough or worrisome enough to warrant the patient to run asking for help. So the most common symptoms are cough, just a dry cough, and nagging dry cough. However, if the cancer advanced more, then you start having more chest pain, shortness of breath, coughing up of a bloody sputum or like rusty color or bloody sputum. And it depends on if the cancer is more advanced, if it's happened to be sitting next to a major blood vessel, then people have like swelling of the face or severe discomfort at the shoulder or the arm. But the most common by far is cough and shortness of breath. But also not to ignore what we call constitutional symptoms, which happens with all cancers, but we see it more with lung cancer, such as losing appetite and weight loss, just have lack of energy and stamina.
For our viewers, what increases the risk of developing lung cancer?
The most common risk for developing lung cancer, unfortunately, is smoking. So up to estimated 90% or even more of lung cancer happens to be in smoker, not 100%. So there are a few cases we see occasionally in men and women who never smoked, but so there are other risk factors involved. But smoking by far is the number one. And the younger the person when they started smoking, the more they smoke, the higher the risk. But there are other risk factors like exposure to radon, which is a gas that's usually comes from the earth and goes through, like a lot of the basement have it. If there's a crack in the basement, and people can check for that all the time. Exposure to asbestos, certain industries, exposure to like nickel or vinyl can do that sometime. And people who have like exposure to diesel fuel, sometimes that can increase the risk. Overall, if you look at areas which are like industrialized area in a country, a lot of smoke, a lot of smog, they have higher incidence of lung cancer than rural areas.
Now, doctor, you mentioned that smoking is the number one risk factor. How dangerous is secondhand smoke exposure?
Extremely dangerous. Smoking does not just the person himself smoking, but exposure to somebody else smoke. So quite often we see lung cancer in somebody who never smoked, but their spouse or significant other or their parents or their brothers used to smoke for years and years, and they sit together in the same room and they inhale the same smoke. So their risk is a little bit less, nonetheless is a big risk.
Is there a way to prevent lung cancer?
Well, modifying the risk factors, modifying the lifestyle. Basically, the most important factor is quitting smoking. It's very, very important, and we stress it one time after another is how important that is.
How do you actually diagnose lung cancer?
Well, after the person goes to the hospital or to the physician, we use like number of tools to help us diagnose it. Imaging studies like chest X-ray, CAT scans, PET scans, MRIs help us identify where the cancer starts and in a lung and how far is advanced within the lungs or other part of the body. Once we suspect the cancer, then we do biopsy, and that can be like getting a piece of the tissue and to examine it under the microscope, and that can be done by a needle through the chest wall or by a bronchoscopy or doing a scope into the bronchial tubes.
Now, is there more than one type of lung cancer?
Of course. The most common type by far is something we call non-small cell. So there are two major types. We call them small cell or not. So the small cell, even though it's the less common type, is about 10 to 15% of lung cancers, and it is very aggressive form, and it starts and grow rather very fast, versus the non-small cell, which is a little bit less aggressive. The non-small cell, there are about three different types. There's the adenocarcinoma, there's a squamous cell carcinoma, and the large cell carcinomas. But the non-small cell about 85–90%, and a small cell about 10%, 10–15%.
Doctor, this has been great information. We need to take a break. We'll continue in a moment.